Okay, for shockwave therapy, we sedate the horse just because it's a little bit painful. I always say it's like mini tsunami waves entering the horse's tendons. So a little bit of sedative, and in a few minutes, the horse will be ready to be shockwaved. So for shockwave therapy, we want to identify where the lesion is. So I'm going to just do a quick tracing of the lesion. So right here, this black area that I've just traced is the lesion. And then what I'm going to do is put a caliper on here, and a caliper will measure the depth. So the depth to the deepest part is 1 centimeter, which is the same thing as saying 10 millimeters. So the pad size that we're going to use to shock this horse is going to be the 10 millimeter pad. Okay, so this is our shockwave machine, so I'll just turn it on. And while it's warming up, I'll just go over how important it is to know the depth of the lesion that you're working on. This is a focus shockwave machine, so all the energy, the actual waves, the shock waves, are focused on a precise area. So all these pads allow the shock waves to go to different depths. So in other words, this is a 35 millimeter pads. In other words, it's shallower on the unit, allowing the beam to penetrate deeper. So that'll go 35 millimeters or 3.5 centimeters. This is a 15 millimeter pad. You can see how more pointed it is, and the most pointed is the 5 millimeter. So it only goes just basically into the skin or just below the skin. So the horse we're working on today, we measured the lesion depth and found it to be 10 millimeters in depth. So this is a 10 millimeter pad that we're going to be using on it. So this technology can be utilized in a very, very precise manner by measuring the depth of the lesion. So I'm going to just take this off now. And it's a fairly heavy head. It's got to be to administer the shock waves. And we're going to turn the unit on to administer 4 shock waves per second. That's the maximum that it does. And then we'll use the intensity of 10 for tendon lesions. That's more for an acute tendon lesion. This horse has a little bit more of a chronic tendon lesion, so we'll go a little bit higher to the 12 category for this horse's superficial flexor tendon tear. Now I'll get a chair so that I can sit down on the job, and we'll go ahead and apply it to the horse's leg. Okay, so we have some ultrasound gel still left over on the legs, so we want to make sure that there's quite a lot there for coupling purposes. This is an excellent pad, as you see, for superficial flexor tendons because it surrounds the tendon, so it gives us a good contact surface. So we'll get it on the involved area, and then I'll press the on button, and away we go. So that noise you're hearing, those are the shock waves being administered, 4 shock waves per second. It's a little bit painful to the horse, but it's not painful if we keep moving the probe. So the shock waves are being dispersed throughout the lesion by changing the angle. And we don't have to do that too dramatically, but we just have to keep the head moving a little bit and angling it at the lesion. So you can see how we're kind of going up and down and sideways throughout the lesion, administering the shock waves evenly throughout the affected area. And then we'll generally administer about 1,500 shocks to a specific area. So at this stage of the game, we're at about 200. So it doesn't take too long to do a therapy, which is quite nice. The only side effects we've noticed from the therapy is that there may be a little bit of swelling at the site where the shock wave's done, and after a day or so, that resolves pretty well on its own. So that's not anything to worry about. Okay, so at this stage of the game, the machine shuts off at 1,000 shocks automatically, so we can't fall asleep at the wheel. And then we'll put a little bit more ultrasound gel on, and at this stage we try to flex the leg a little bit, because that gives us a little bit a better angle. There we go, for the administration, and then we'll continue in the flex position. Sometimes it's important to feel where the lesion is because it moves when the leg is flexed. So you can see it's a little bit higher now. You can feel the knot in it. So people ask me what this does to the tissues, and essentially there are several theories on how shockwave works. One is that it stimulates local growth factor release from the tissues, which enhances healing. It also is said to recruit stem cells into the area, so that inactivated stem cells are already there. So that's another theory. And then the third theory is that it does increase local circulation. So those are three ways in which it's known to work. Okay.